Okay, welcome everyone who's on Zoom and the people who are here in person. We're very excited to have a great speaker today that I've known for a long time. Then Dad's name is John Balmes. He's from he was a professor emeritus from the Department of Medicine and the School of Medicine. Um, Dr. Balmes has an interesting career. He learned a lot of things from a lot of places. He got his bachelor's degree from the University of Illinois in Urbana, and then his MD from Mount Sinai School in New York. And he was a resident there at Mount Sinai as well. And then he went to Yale University for a postdoctoral fellowship in pulmonary medicine. So he started out in internal medicine and then did pulmonary medicine. He also, from 1986 to the beginning of this year, he had been from divisions of occupational health, environmental medicine, and pulmonary critical care medicine. He does all of those things. So that was very helpful. The most relevant to his talk today is that he served as a physician member of the California Air Resources Board since 2008. And so he knows a lot about what of the experiences of the people who are exposed to fire smoke and other kinds of smoke does to the lungs. So that's what we're going to learn. His topic is really about the health effects of wildfires. Can you imagine the people down in LA who were trying to get out and all the smoke they had to breathe in to get out? It's things like that. Even now, we're worried about the Canada. Northern California fire season is here now, and we got through Los Angeles, but now there's coming smoke in from Canada. So we have lots of patients around that we need to look for. We need intervention, and we're lucky that we have a good look from John. So go ahead, John, and start your talk.
Thank you, Susan. And since you've already mentioned air quality in the Bay Area, secondary to fire smoke from Canada, I don't know how many of you have noticed that it's been hazier than normal out there. Fortunately, that fire smoke is up high and makes it look hazy, but actually hasn't affected air quality much down low where we breathe. But our own fire season hasn't really started yet, and it's predicted to be a bad one by Cal Fire. So just as a disclosure, Susan's already mentioned it, I am the physician member of the California Air Resources Board. That's a paid position with the state, but I have no other financial conflicts to disclose. And I'm going to talk about wildfires in general, wildfire emissions, health effects, mostly respiratory and cardiac. I'll mention some other ones. I've done a lot of work with wildland firefighters who are more heavily and chronically exposed than the general public, so I'll talk about that. A little bit about post-wildfire cleanup, because that's a big issue right now in LA. And one slide on outdoor workers, mostly construction workers and ag workers. So the fire that probably got most of your attention was the Camp Fire in November of 2018, which took out the town of Paradise. This is what's called a wildland urban interface fire, because while the fire started in forest land, it came into the town of Paradise and burned buildings and motor vehicles, which add to the toxicity of the smoke. And as you probably remember, those of you who were around in 2018, This is a satellite photo of the plume from the campfire going all the way down the northern Central Valley and then out through the bay. And at that point, that was the worst air quality we'd ever had in terms of fine particulate PM 2.5, ever measured in the Bay Area. Moving forward to 2020, 2019 wasn't that bad of a fire year. 2020 was actually the worst season we've had with regard to air quality. And the satellite photo from August 24th on the left is of the entire Pacific coast from down Baja California all the way up to British Columbia. And every one of those red dots is a wildfire. It was really incredible. And I know that many of you remember September 9th, 2020, when it looked like Mordor in San Francisco. I remember teaching a class in the UC Berkeley UCSF Joint Medical Program, and the students who knew I was a wildfire person said, "John, how bad is the air to breathe?" It really wasn't that bad that day, believe it or not, because again, most of the fire smoke was up high, which blocked out the rays of the sun, so it looked dark during the daytime. The next day, September 10th, was a lot sunnier, but very hazy. That's when the fine particulate dropped down and got into our breathing zone. So you can be fooled by how nasty it looks up in the sky. It's really at the surface, the ground level, that matters in terms of our breathing. So why do we have bad wildfire years? Probably everybody knows this, but the Sierra snowpack is what makes a difference about how much drought we have. And so I said 2019 wasn't a very bad year, and you can see there was a big snowpack. 2020 was a horrible year for drought, but that's because we had very little snowpack. Fortunately, to some extent, the last couple of years have been decent in terms of snowpack. The trouble is that the wildfire season in California typically ends when autumn rains begin. After years of drought, there are many dead trees. Even when we have a good snowpack, there's still the dead trees from previous years. There's always increased growth of vegetation in the spring, and that's mostly grasses. And so, the normally dry and very hot summer weather we get adds new fuel to the dead trees, and it all depends on when we get rainfall. And this is just a slide showing it's only up to 2020, but annual acres burned by mega fires in California. And we've always had wildfires in California as part of our ecosystem. But it's only in recent years that we've had these mega fires. Sort of a combination of climate change, meaning prolonged drought and high temperatures, and then really a legacy of fire suppression over the years. I don't agree with President Trump about too many things. When he said that we need to be raking our forests, and those are the federal forests as well as the state forests, raking isn't the answer, but we do have to clear the underbrush to make our forests more resilient to fire. So the U.S. Forest Service for many years has tried to put out lightning fires by the next day, by 10 o'clock in the morning the next day. They send in smoke jumpers they parachute from planes. That's the first attack in a forest. And then they have hotshot crews hike into a forest to put out the fire. But it turns out that that's really bad for forest management. To reduce the risk of mega fires, we need to let lightning fires burn because they usually don't turn into mega fires by themselves. Different story when we talk about power lines causing fires, but uh, the Forest Service, U.S. Forest Service, which is responsible for putting out fires in national forests and parks, and CAL FIRE, which is responsible for state fire suppression, and they work together on any big fire in a coordinated way. They all agree that we should let small lightning fires burn and not try to rush to put them out. It's tricky, though, to know when to put a fire out earlier rather than later. So I've already mentioned this. The map on the left shows areas at risk for mega fires. The darker the color, the greater the risk. Uh, and so, Montana, for example, has lots of wildfires. Uh, Yellowstone also has had multiple fires. Uh, Prescribed fire is part of the way that we reduce fire risk. There's mechanical clearing and there's prescribed fire. And Native Americans in California have known for years and have practiced for years prescribed burning. They actually, the Yurok tribe in Northern California actually has a yearly course or class for professional wildland firefighters to teach them about prescribed burns. So we have to do more with prescribed burns as well as mechanical clearing to manage our forests better to reduce risk of wildfires. So let's move into health impacts a bit. And this slide I like very much because it really shows that there's a positive feedback loop, unfortunately. So with climate change, dry, hot weather, we get wildfires. They emit multiple pollutants, which I'm going to talk about more in the next slide. That leads to poor air quality, but it also leads to some of these pollutants are climate forcing. So it actually makes things worse in terms of climate change. For example, the big fires in Australia that occurred in the winter of our winter, their summer of 2019, 2020, took out a lot of land. I think it's the size of Connecticut, maybe bigger. And the Australian equivalent of our US EPA estimated that the amount of climate forcing emissions from those wildfires were equal to a whole year uh, of man-made emissions from power plants and motor vehicles. Same is true in California. It's been estimated that about 50% of the PM 2.5 fine particulate in California is now contributed by wildfires. And that's also climate forcing. So a little bit more about the emissions from wildfires. We focus mostly on particulate matter in terms of health effects, in part because it's the most easily measured, and there's been a lot of research on the health effects of particulate matter. Carbon monoxide exposure is not so much a problem for the public unless you're right in you're evacuating from a rapidly moving fire. But the wildland firefighters do get exposed to carbon dioxide, which is generated whenever a carbon fuel burns. And that's a problem because wildland firefighters don't have an effective type of respiratory protective equipment to wear. As a pulmonary critical care physician, I had to wear N95s when I didn't have a beard, or a portable air purifying respirator, PAPR, because I have a beard. Wildland firefighters can't wear that type of either an N95 or a PAPR because they work 12 hours on a fire line working really hard, and neither is uh, is feasible. Uh, it's a big problem, and people are working hard to come up with better respiratory protective equipment for wildland firefighters, but nothing has really uh, met the test so far. Now, oxides of nitrogen also are generated whenever there's combustion, and nitric oxide emissions can turn into air pollution, particulate matter. It's called secondary aerosol in the atmosphere. So that's a problem. And then there's some nasty potential carcinogens and polycyclic aromatic hydrocarbons, PAHs, are also generated whenever carbon fuel burns. And volatile organic compounds, in addition to an irritant like acrolein, there's also formaldehyde and benzene, which are carcinogens. And I like to say that wildfire smoke without buildings or cars burning is like cigarette smoke without the nicotine. And I've already mentioned secondary air pollutants, particulate matter, mostly generated from nitrogen oxide, and then ozone is generated by all the NO2 that's emitted. Ozone and NO2 are in a chemical equilibrium with each other. So I've mentioned the wildland urban interface. This is a photo from the Thomas fire, which was the fire in December of 2017, during which Jerry Brown, then governor, said, "This is the new normal." Fires well into even the winter at that point. I guess it was very late fall. It was like mid-December. And this was in Montecito. And you can see homes in the foreground, fancy homes actually, and the fire moving towards those homes. So when buildings and vehicles burn, you get more of a problem than just plain wildfire smoke. So structural fire smoke, urban fire smoke, if you will, contains other toxic air contaminants aside from the ones I've mentioned: hydrogen cyanide, hydrochloric acid, phosgene, and various heavy metals. And then toluene, styrene, dioxins. Nasty stuff. That's why urban firefighters wear Scott air packs and breathe clean air while they're fighting the fire. Unfortunately, wildland firefighters can't carry in 35-pound tanks that last for 20 minutes when they're carrying in their tools and hiking into mountainous forests. So again, this is the campfire photo that I've already shown you. And you can imagine the toxic materials that are emitted when a car burns or a house burns. And I didn't bring a lot of slides about LA fires, but the most impressive wildland urban interface fires that we've seen in I think in California recorded history, has been what occurred this past January in LA with the two fires, the Eaton fire in Altadena and the fire in the Pacific Palisades. And this is just a picture of how raging the fire conditions were. And then this is the next day, there was still plenty of smoke. So who's most at risk for health effects? So young children who have developing lungs and immune and other organ systems. Older adults like me, especially those with pre-existing respiratory and cardiovascular disease, which fortunately I don't have. people with obesity and diabetes who are at risk in general for air pollution effects, including wildfire smoke, pregnant women and their fetuses, and people from low-income communities of color. Uh, and that's usually kind of a double whammy where they are increased risk because of their housing and employment, but also maybe increased susceptibility because of, poor access to healthcare, uh, toxic stress for being undocumented, for example, or for just racial, ethnic discrimination, which contribute to air pollution health effects. So I was involved in this uh, review of health impacts of wildfire smoke exposure, did with a doctoral student, Colleen Reed, and folks from University of British Columbia, the British Columbia CDC, and colleagues at Berkeley. And I like to show this picture. This is during the Thomas Fire, the same one I showed you of the Montecito hills burning. The smoke traveled down to West LA. This is a family, I think, taking their kids to school. They're all wearing N95s. But should they be out uh, during this bad air quality from the wildfire smoke? And are the kids adequately protected from an N95? N95s are not approved for kids. They're only approved for adults. They're actually approved for occupational exposure to PM 2.5, not really for the general public. So, what did we learn from that critical review of the literature? And it was basically up to 2016. So, 9 years ago. We saw clear evidence of an association between wildfire smoke and respiratory health. Almost every study that looked at asthma exacerbations found that there was increased risk with poor air quality due to wildfire smoke. And most of the studies with regard to COPD showed the same thing. And at that time, there was growing evidence of a link between wildfire smoke and respiratory infections, which has strengthened since 2016. What we didn't find back then was much of an association between wildfire smoke exposure and cardiovascular health, but that has been the big change since our review. So just a little bit about the respiratory health effects of wildfires. I don't know how many of you remember the 2008 Northern California wildfires. There were no really super dramatic ones that were like taking out towns, but there were a lot of fires all at once, from around Santa Cruz to farther north and farther east. And the month of July was really nasty. And so my doctoral student, Colleen Reed, same one who led the the critical review I talked about, she decided that it would be pretty cool to study before, during, and after that bad month of July. It was also really hot. So not only was there a lot of smoke, there was a lot of ozone because it was also very hot. So she found with our assistance, for every 5 microgram per meter cubed increase in fine particulate, that there was increased risk of asthma hospitalizations, asthma ED visits, and COPD ED visits, all statistically significant. And there was a greater effect in women and those living in lower median income zip codes. That study was included in our critical review, but this study from 2021 was not. And a group down at UC San Diego and Scripps found that fine particles in wildfire smoke impacted pediatric respiratory health. And they were able to distinguish ambient PM 2.5 from other sources from wildfire smoke. It's actually pretty simple. You take satellite photos of where the wildfire plume is. And then you can take satellite data uh, from that same area when there wasn't a wildfire smoke episode, and you subtract out the baseline from the peak during the wildfire smoke plume. So they did that for uh, San Diego County, and they actually had almost complete capture of all pediatric emergency visits and urgent care visits. And they showed that during 2011 to 2017, uh, that a 10 microgram per meter cubed increase in fine particulate from non-smoke sources was associated with about a 4% increase in ED and urgent care visits. That's well known that PM 2.5 causes kids to, especially kids with asthma, to have symptoms. But what was surprising that during the wildfire episodes, there was like a 30% increase in visits, a tenfold increase. They've done several other papers in adults from that same period. So their work is some of the strongest evidence that in terms of respiratory outcomes, that wildfire smoke PM 2.5 is actually more of a respiratory toxicant than regular non-wildfire PM 2.5, mostly from motor vehicles. And then, of course, you all remember June of 2023 when wildfire smoke from Quebec blanketed the Northeast and caused New York City to be the most polluted city in the world on June 7th, 2023. And it also was dark because of that smoke. New York City also looked like Mordor that day, or a couple days. And you can see here a time series of the peak of the smoke uh, concentrations. Oops. And there was also a peak in asthma emergency department visits at the same time. And there were two different studies, one from NYU and this one was from folks at Yale that basically showed the same thing, both published. So respiratory effects of wildfire smoke, there's really no question. But cardiovascular healthcare utilization is also impacted. And this is one of the first studies that was very convincing in this regard. It was actually led by a UCSF medical student, Zach Wetstein, in collaboration with the California Department of Health and US EPA. This was published in the Journal of the American Heart Association in 2018. And they were using data from 2015, which wasn't a particularly bad wildfire year. But they used that same technique where they had satellite data during a wildfire smoke plume, and they subtracted out the baseline satellite data from a non-wildfire smoke period for the same area. And they found the expected respiratory healthcare utilization that was been shown by many studies. But what was new was they found a cardiovascular effect. These are exacerbations of underlying cardiovascular disease, both cardiac and cerebrovascular. So there have been subsequently multiple studies that have shown similar data across the country. But I like to highlight this because Zach took a year off to do this work while he was a medical student at UCSF. So Marshall Burke at Stanford is one of the leaders of wildfire smoke assessment. Has published multiple papers in this regard. But that bad 2020 summer, which I showed you like the satellite photo from, and September 9th, 2020, we had darkened skies. He went and looked at that month of bad air from August to September of 2020, and he looked at what the excessive emissions were at PM 2.5 due to wildfires. Excessive meaning over the average. So he did it in San Jose, San Francisco, Bay Area, Sacramento, LA, and Fresno. And uh, the bad air quality in 2020 affected all of these areas except for LA. The smoke didn't go that far south. So LA didn't really have any peaks over their baseline. Fresno, Sacramento, Bay Area, San Jose all had increased levels of PM 2.5 above their 2015, 2019 average. And he went on to estimate, based on what the US EPA concentration response, exposure response curves show, that would be 1,200 to 3,000 excess deaths across Northern California, mostly cardiovascular, related to these excessive exposures. So this was, a health impact assessment kind of study. It wasn't actual data collected, but it's probably fairly reasonable, nevertheless. So back to wildfire smoke and infection. A group from Harvard, which has very good county level data across the US, actually. They've done Medicare analyses across the US and exposure to PM 2.5. They decided to look at PM 2.5 due to wildfire smoke in 92 counties in Washington, Oregon, and California. And they found an excess of COVID-19 cases and deaths. This is during the 2020 wildfires at the peak of the pandemic. They found an association with both cases, incident cases, and mortality due to wildfire smoke PM 2.5. And then another infectious disease study was done in Montana. And so what they did was they mapped wildfire PM 2.5 across the state, and then they associated daily PM 2.5 concentrations during the wildfire season with influenza following during the flu season, late fall into early spring the following year, following years. And they found actually that there was an increased risk of influenza infection subsequent to experiencing bad wildfire smoke, which actually is a pretty common problem in Montana almost every year. So it's not as strong of an effect as what wildfire smoke does with regard to respiratory healthcare utilization, but there's increasing evidence that wildfire smoke poses a risk for respiratory infections, and that would be in people who don't have pre-existing heart and lung disease, but the general public. So what are our knowledge gaps about wildfire smoke and health effects? Well, we know a lot about the short-term effects, but we don't know anything about longitudinal effects of current exposure, especially for kids, in terms of growth of lung function, the immune system, other organ systems, cognitive development for that example, that matter. And we don't know the relative toxicity of wildfire PM 2.5 compared to that from non-wildfire combustion sources. We have the epi data from the San Diego studies, but we don't really have that good of a toxicology studies with regard to the difference between the different types of PM 2.5. And there are Some of my colleagues who study air pollution health effects really don't think that the cardiovascular risk that's been seen in PM2.5 is real. They think that maybe respiratory effects, but not cardiovascular. So this is an important area of research. And then we don't really understand how wildfire smoke enhances the risk of lower respiratory infection. I can do some hand waving, alveolar macrophages that are uh, loaded with carbon, whether that's from cigarette smoke or wildfire smoke. Uh, they don't function as well in terms of uh, responding to either viruses or bacteria, but that's still kind of hand waving at this point. And then we really need to know about the effectiveness of like indoor HEPA filtration devices. And we know that that can reduce the exposure to wildfire PM 2.5 that uh, infiltrates a home, but does it really reduce the risk of health effects? That's not very well studied. Well, I think I have time, yeah, to talk about one of my favorite topics is wildland firefighter health effects. This is a population that is much more heavily exposed and much more continually exposed, certainly during a given fire year. But there are career wildland firefighters, both for the state, that's CAL FIRE, and federal U.S. Forest Service and National Park Service firefighter. So what we know, and I've actually contributed to this work, uh, across a 12-hour wildfire uh, shift, we've seen decreased lung function, increased urinary biomarkers of exposure. That's not surprising when you look at the level of exposure to smoke, and blood biomarkers of inflammation. But whether those persist is another story. These are very healthy folks. They basically have to go through a boot camp similar to what Marines go through because they have to be very fit. And they actually have required exercise every day when they're not fighting fires. I also contributed to a study pre and post season. We actually went up and throughout Northern California, went to hotshot crews stations, and we measured spirometry and methacholine challenge in the field in April, May, and then we went back in October, which was then the end of the fire season. This was a study done in the late 80s. But we still don't know whether the long period of time away from fighting fires, winter, spring, allows healing of any or reversal of any changes that occur during the wildfire season. NIOSH was trying to do a study, long-term effects of wildland firefighting. They started right in 2019, right before the pandemic, and then they had to cancel that. The person that was leading that study is one of my former doctoral students, Kathleen Cat Navarro. She actually became a wildland firefighter, U.S. Forest Service hotshot crew member, in order to be embedded with the firefighters so she could assess exposure for her dissertation. And she did that and published multiple papers. But this study was after she graduated from Berkeley with a PhD, and this was a health risk assessment about what we know about wildland firefighter exposures. Because of her work and others, we knew that the daily dose of wildfire smoke when firefighters are on the fire line. And we estimated there are about 98 days per year of exposure. That's about how many days people are on the fire lines. And this is in micrograms. The National Ambient Air Quality Standard for PM 2.5 is currently 35 micrograms per meter cubed for a daily 24-hour dose. So this is many times higher than that. Uh, so these guys guys and gals, because it's both genders, uh, get exposed to a lot. And then we estimated various career durations. Some people are in the Forest Service firefighting crews for like 5 years, but some up to 25 years. And so we estimated the risk of lung cancer and cardiovascular disease mortality. And, from 5 to 25 years is 8 to 43% for lung cancer risk and 16% to 30%. Now, again, these aren't actual measured data. These are estimated risks based on what we know about the PM 2.5 exposure response relationships that the US EPA uses. Other components of wildfire smoke are important to think about. So the composition, as I've mentioned, is variable depending on the fuel burning, especially whether there's a fire in the wildland urban interface. And I've talked a lot about the 2018 Camp Fire, which took out the town of Paradise. So the California Air Resources Board, the agency that I'm involved with, measured lead levels in the smoke plume as far as San Jose uh, that were elevated. Uh, and again, it's not from the vegetation that was burning, it's from uh, lead in houses and cars. And also, hexavalent chromium has been detected in the soil after wildfires in California, especially the Carr Fire, which was west of the town of Redding. It was a nasty fire, I think in 2021. So then there's post-wildfire cleanup. The ash contains toxic materials, especially uh, in a densely populated urban area like LA. I'm going to show you some photos of that. So the gentleman, by the backhoe here is wearing appropriate respiratory protective gear, as well as a Tyvek suit. But often day laborers without proper training are hired to do cleanup. That's not actually appropriate or even legal, I don't think, but it happens. And those folks might not even speak English very well and are certainly not trained. So that's an issue. What's in the ash and soot? Well, of course, there's charred wood and fine carbon dust. And those fine carbon dusts uh, are not inert carbon. They're often have complex toxic hydrocarbons like PHs and quinones on their surface. Metal fragments and dusts, I've already mentioned lead. Arsenic is another frequent contaminant of ash after a wildfire because of arsenic treatment of wood to make it less susceptible to pesticides. Excuse me, pests, not pesticides. Uh, then there's asbestos, which is in many older buildings, many older cars, pesticides, and then household chemicals and solvents. There's also drinking water contamination with benzene. That was studied well after the uh, campfire. The water system in Paradise was totally contaminated with benzene from plastic pipe that had burned. So debris recovery at the scale of a town being taken out, and I'll show you the next few slides how it's being done in LA. Phase one is governed by the US EPA, and that's removal of household hazardous materials by trained experts who are properly wearing personal protective gear. And that's the first step in the recovery process. Once an area has gone through phase one, then phase two is run by the U.S. Army Corps of Engineers. They bring in heavy equipment, and there's bulk removal of debris, soil, and ash. So these are pictures from the LA uh, post-fire cleanup. These are showing US EPA uh, phase one cleanup folks, and they're removing toxic materials. And this is just an overhead view of the same kind of work. And this is just, a couple houses. There were block after block in both Altadena and uh, Pacific Palisades. So I said I would talk a little bit about outdoor workers. So Cal OSHA came up with an emergency standard for outdoor workers a few years ago, and it's still in effect. So if feasible, uh, outdoor workers are supposed to go inside, but that's not gonna happen for farm workers or construction workers. So the standard says that N95 respirators should be uh, offered to workers if they can't lower the PM 2.5 levels to an AQI of 150 or lower. It's the air quality index. Now, it doesn't force the workers to wear these N95s, and I think that it's not likely that ag workers picking crops in 100-degree heat are going to be wearing their N95s all day when there's bad air quality. So my last few slides are about the future. So I've mentioned the wildland urban interface a lot. California has the greatest number of houses in the wildland urban interface of all states. We've aggressively developed the Sierra foothills. And so there are 5 million housing units that are in wildland urban interface areas. They're not all in the Sierra foothills by any means. We have them right here in the Bay Area. But it's a large percentage of California's housing stock. And so expansion of homes in the wildland urban interface brings structures and populations in closer proximity to fires. And we really need to think through whether we should allow that development to occur because it costs lives and a lot of money and energy to put out mega fires in the wildland urban interface. So how can communities protect themselves? Well, at-risk communities can do more to prepare for wildfires. This is a fire threat map that CAL FIRE puts out. I think this is last year's, probably not much different this year. Wherever it's red, it's a wildfire prone area. I live in the Berkeley Hills and we're pretty fire prone as well. So, bulldoze fuel breaks around neighborhoods. You can install new smoke detection cameras and sensors. Remove vegetation around homes. Many of you have heard about where I live, Berkeley has a new ordinance to remove all vegetation within 5 feet of the house and wood fences that are within 5 feet of the house. I have both vegetation and a wood fence that's against the current rule. Fortunately, they're starting with even higher risk people up at the top of the Berkeley Hills. I'm halfway down. So we're the next group probably. Probably have a year or so before we have to do that heavy lifting. Improve escape routes and subdivisions. So most of the people that died in the campfire in Paradise didn't die because they were burned in their homes. They were burned in traffic congestion when they were trying to get out because they only had these, barely 2-lane dirt roads that were packed. But it's not just in rural areas like Paradise. It happened with the Oakland fire back in the 80s, the Oakland Hills fire, there were people that had trouble getting out. Uh, They were paved roads better than in Paradise, but there were too many people trying to get out at the same time. So we have to do much better about escape routes. And then train residents in initial fire suppression methods. Uh, Australia is very much ahead of us. In Australia, people water down their roofs uh, during fires where embers might, if the fire is raging into your neighborhood, you have to evacuate. But when the fire is some distance away, but embers are falling, that's when watering down roofs can really make a difference. And that's been shown to make a difference in Australian communities. So I think I'll end there and see if there are any questions. Thanks.
I can give it to them. Are you asking for?
Yes, and if there are individuals at home that would like to write in the chat or Q&A questions, please pass forward. Answer them for you.
Lots of questions.
Go ahead.
Yeah. Dr. Balmes, what about maybe a little off the subject? Right at the moment, we're looking for an air purifier for our home. What do you recommend?
That's a good question. So first of all, don't buy an air cleaner that's an ionizer. That generates ozone. My agency, the California Air Resources Board, has certification of low ozone or non-ozone air cleaners. So you should make sure that whatever you buy isn't an ozone generating cleaner because they can actually generate a fair amount of ozone and cause harm. With regard to strictly HEPA filtration devices, there are a lot on the market. And you can pay from like $200 to $2,000, depending on how many bells and whistles you want. The most important consideration is the clean air delivery rate called KDAR that you have to have the appropriate clean air delivery rate for the size of the room you want to filter. So if it's a smaller bedroom, you can get away with a filtration device that has a lower KDAR. But if you're trying to, filter a big living room, you might need a higher KDAR filtration device. And so you need to know the size of the room that you want to filter. So I have a relatively fancy. My wife has asthma, and she has definitely had exacerbations related to wildfire smoke. I don't know if Homer managed to listen, but part of the reason I love Homer is that he essentially almost cured my wife's asthma, but she still has exacerbations related to wildfire smoke. So we have a filtration device for our bedroom that's fancy. It's got bells and whistles. Then we have a much cheaper one for where we work in our dining room. Now that neither one of us, we're both retired and not going to to offices. That's a smaller room, and we're fine with that device. I would, Wirecutter has a good list of recommended filtration devices. Some of them look a lot nicer than others, and some are quieter than others. But if you buy any of the ones on the Wirecutter list, you'd be fine.
Good.
And then I don't think it's probably an issue for this audience, but you can actually make effective do-it-yourself ones with a box fan. You buy MERV 13 filters from a hardware store, which you can put in a central ventilation for your home. that's also very effective. We have both the MERV 13 in our central ventilation and then the two HEPA filtration devices in the rooms we spent the most time in. But you can buy MERV 13 filters from a hardware store and put them on either side of a box fan. It's been shown. There are good studies that show that you can reduce indoor filtration or indoor levels of wildfire smoke PM 2.5. Long answer, but it's something I get asked all the time, so I was prepared.
Good.
I have a question. I live in Berkeley too, and I want to know if the Berkeley ordinance really would be effective for the 5-foot clearance around the house.
Well, I'm not an expert on that, but I think, yes, I think there is evidence that makes a difference. Because the firefighters do a better job at controlling the vegetation when that's burning than when a house catches on fire. So if we can kind of keep the fire from really destroying houses, that actually, you may lose some houses where the fire initially hits, but you shouldn't have the kind of massive fire loss of homes that you had in LA. So there's evidence that makes a difference. It's not perfect, but my wife and I don't want to get rid of the vegetation that's close to our house, or especially our wood, fence. But we're going to do it because we do think it makes a difference in terms of reducing risk of fire. Fire
Thank
spread.
you.
Anybody else? Any other questions? Anyone from home? Thank you, Dr. Balmes, for joining us today. We appreciate all this great information. This will be online, hopefully within the next couple of weeks. And that is all. Thank you, everybody, for joining us here and at home.
Yeah.
Okay, thank you, Susan, and thank you, Louise.
Thank you, John.
Bye-bye.